So, Dr. Shilpa, obviously, you treat a lot of patients with sleep-related disorders, right? Would you mind sharing some of the more common ones which you have seen in your practice?
Right. I think a large portion of patients are coming in to see me because they're being sent by their other specialists, cardiologists, endocrinologists, weight loss management doctors are having difficulty with reaching their goals. So, if, for example, a patient has diabetes, even though they have changed multiple medications or they have tried different things, they are not getting their ideal sugar control. And that's when the endocrinologist thinks, is there something else which is affecting my control of diabetes? And thank goodness now it is coming up that sleep is something that does. And so I'm getting referrals of patients who need to be evaluated for their sleep. And I'll tell you, 60 to 80% of patients who are diabetic have an underlying sleep disorder. So, and the most common sleep disorder is obstructive sleep apnea. So, once we diagnose the sleep apnea, then we treat the sleep apnea, guess what? Their diabetes gets better. So, so that's for endocrinologists, and then for heart specialists I'm getting referrals because hypertension is not well controlled, or patient is having coronary artery disease or heart failure, and there is an underlying sleep disorder that is trying to be ruled out. And once we diagnose it and rule it out, then we are improving their cardiac function. Arrhythmias are also another reason. So atrial fibrillation is seen in a lot of patients. It's common, and one of the known reasons for atrial fibrillation is undiagnosed, untreated sleep apnea.
Wow. So seems like the iceberg is truly somewhere else, right? I mean, like the problems emanate from somewhere else versus the this thing.
Yeah, I
Uh,
think that it correlates. Like, I think a lot of patients who have diabetes or who have high blood pressure or who have heart conditions also have the sleep apnea, but the sleep apnea symptoms are very subtle. So you're a little bit sleepy, but you don't really focus on that. What you're focusing on is the symptoms for diabetes, the symptoms for heart failure, symptoms for high blood pressure are more problematic. They come to that you definitely get diagnosed much faster with those things, which is good. And then you start treatment. But then the patients that are not doing well with their treatments, those are the ones that are coming in. Now our goal is, of course, to treat all the patients that are diagnosed with these conditions should have a sleep evaluation. But now our goal is to raise awareness, public awareness, that sleep is something that you should be looking at for yourself. And if there's concerns, we should be evaluating sleep because it improves your diagnosis. So if you are pre-diabetic, if you had a sleep disorder and we treated it, maybe you wouldn't become a diabetic. We could, of course, with in addition to all the other stuff that you need to do for diabetes, we want to get a better, diet and exercise and all of that. But sleep is a big portion of it as well. So that's where we are trying to raise public awareness for that.
right. So, Dr. Shilpa, thank you so much for explaining to us what is sleep, the various cycles, etc. So let's talk about where do we start. Firstly, diagnosing for all of this, then the treatment, etc. So what? So my first question is, I know you're a sleep doctor. What is a sleep doctor?
So sleep doctor is somebody who has done training in specifically sleep. There is fellowships that we do. For the sleep fellowship, it's 1 year that we study for just specifically sleep, and then we take an exam. So you have to know that your doctor is sleep boarded, or sleep eligible. So that means that they have taken the training and they're waiting to take the board, or they're sleep boarded. That means they took the board and they passed it. So that's a sleep boarded physician.
And what is a sleep doctor really doing for you? If I were to come in as your patient, what would they do for me? And what am I supposed to be? How am I supposed to be interacting with a sleep doctor?
Right. So, I mean, you can very easy to search for sleep doctors, just like any other specialty. You can Google us. and look for a sleep doctor, sleep boarded physician near you. You can call your insurance company and find out who is a sleep boarded physician who is in network for you if you're going through your insurance, and find us that way. And then what are you expecting? You should definitely make an appointment, come in. If you have sleep concerns, we usually start by the first visit is a consult visit, which is very important. So if, unfortunately, this is one thing that I'll say a lot of people are claiming to treat sleep. You should really know who your doctors are, who is treating you, and what is their training. And a lot of companies are just sending you devices at home to get tested, and nobody's really looking at it. Nobody's following up. That's probably not the best plan. You should go to a sleep doctor, sit down one on one, just like you go to your cardiologist. You should go one on one for them to evaluate what is your problem. Maybe it's just a sleep issue because you're having these sleep symptoms because you're not sleeping enough adequate hours, but somebody has to evaluate for it and then treat it and then give you a treatment option and treatment guidelines, guidance accordingly to what your issue is.
And then, Dr. Shilpa, I forgot to ask you. You've been using this word sleep apnea quite a bit. What? Say more on that.
Right. So obstructive sleep apnea is one of the most common sleep diagnoses. It can be in children and in adults, and the most common reason for that is because your airway is collapsing. So if basically when we are sleeping, of course, we talked about this, all of our muscles are more relaxed, and when we're breathing, we need the air to go in and out of our airway. But if the airway is collapsible, then it's hard for the air to pass. And so, if this was our airway like a circle and the top is kind of collapsing down when we're breathing, if there's partial collapse, it's hard for the air to pass. And that's when we have noisy breathing, which we call snoring. And if there's complete collapse, then there is no air passing, and that's what we call apnea. So, if you are stopping to breathe for short periods of times, and we're talking about like short periods, 20 seconds at a time, if you're stopping to breathe during your sleep, and you're having dips in your oxygen, then we count those events. And depending on how many events are happening per hour, we diagnose you with sleep apnea. And then we further break it down into mild, moderate, and severe.
Okay. All right. So, Dr. Shilpa, so give us a treatment protocol for sleep apnea. I'm not asking you to treat somebody. I'm just asking you, like, what's the process to follow for, okay, step one, do this, step two, do this, step three, do that for getting the right help.
Okay. I mean, of course, find yourself a sleep doctor first and
Right.
then get the right study ordered. So, there are sleep studies that we do, which is basically we are monitoring your sleep for usually one night. Sometimes it can be two, or more, but we usually do a single night sleep study and then we try to diagnose what is going on with your sleep. So, sleep studies can be done in lab, which means that we have sleep labs, and you would come over there. We'll put a multiple leads on you. These are all stickers. There's no needles. We put a lot of stickers on your head and chest. So it's an EEG and an EKG, and there are arm leads and oxygen leads, and it's a very comprehensive study where we're just monitoring your sleep. So you go to sleep, it's not under anesthesia, so we're not giving you any medications to put you to sleep. You just go to sleep naturally, and we are just recording the whole night and seeing what's going on. That's an in lab study. And then there is also home sleep studies, which can be done now, which can be done in the comfort of your own home. So you can go see a sleep doctor. They can order a home sleep study if you qualify for it, and then they'll set it up for you. You go home, get the sleep study done at home in your own comfortable bed, and then we read it and try to figure out if you have a sleep disorder, and then based on the results we can talk about the treatment options available for you.
So treatment options would include, like, just give us a flavor of what could be all the types of treatment, you know, proposed, right? From basic to more advanced.
Right. So, for as I said, for sleep apnea, we break it down into mild, moderate, and severe, depending on how many events of stopping breathing you're having, how many of these apneas you're having per hour. Up to 5 episodes per hour is actually considered normal. So we all stop breathing a little bit when we go to sleep. If you're having, yeah, if you're having about 5 episodes of stopping to breathe 20 seconds each episode, and 5 of those per hour that you're going to sleep, you don't have sleep apnea. But if it's, and you could be snoring during that time too, and that's okay as well. It's more than that. So if it's more than 5 episodes per hour, then you have sleep apnea. So 5 to 15 is mild for an adult, and the criteria for pediatric patients is different. And 15 to 30 is moderate sleep apnea, and greater than 30 is severe. The reason I break it down like that is because the treatment options vary depending on if you have mild sleep apnea, moderate sleep apnea, or severe sleep apnea. So for mild, for all of them actually, the sleep hygiene that we talked about, that's really important. Meaning that you need to be getting enough hours of sleep, because that is going to, if you have sleep apnea, that's obviously already affecting your sleep, and then you're not getting enough hours of sleep. That's a double whammy. That's making it even worse. So that's something which is controllable. You can do that. And then weight loss is very, very big, because we know that if you lose 10 to 15% of your body weight, that makes a dent in your sleep apnea. So if you have, and it's very like intuitive if you think about it. If you are very overweight and you have a whole lot of body weight of fat on your chest and your neck, and you're trying to sleep on your back, this is pushing down on you. Now your airway has to not only work against gravity, it has to push up all of this weight. So the more weight you can lose, you definitely improve your sleep and your sleep apnea. So that's one of the things that I highly, highly recommend for all patients who have sleep apnea. And then moving forward, then there are other treatment options, which are devices that can be used, like CPAP devices or oral mandibular devices that can be used for sleep apnea.
So, Dr. Shilpa, thank you so much for educating the audience here, and we really would want you back. But any closing remarks for the audience?
Um, yes, I think that I would say if you are sleeping too much or not sleeping enough. So I think if you're too sleepy or if you're sleepless, you definitely need to see somebody for that to evaluate. And then I guess it's easy to find the sleep doctor. If you're in Orlando, please reach out to me. I would be happy to take care of you. And don't be afraid to, I think one of the things that I would say is that people are afraid of diagnoses. So they kind of like put it, under the table, like they don't want to get tested because they don't want to know. And so don't be afraid of the sleep doctor. And we're trying to all get you to better health. And I think sleep is a big portion of your overall health. So get evaluated, get screened first, get evaluated if you need it to be, get tested, and then talk about the treatment options which make sense to you. And your sleep doctor should be able to work with you to find an option of treatment which will work for you and improve your overall health.
I thank you so much, Dr. Shilpa, for being with us here. Thank you.
Thank you for having me.